I'm Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity. This vlog is on income, economics, and health. Among social determinants and influencers of health, financial realities are a major consideration. Worries about finances came in as the #1 stressor across all age groups, according to the 2018 Everyday Health United States of Stress survey, and 2019 was no different. In fact, worries about finances are consistently cited as the #1 stressor across all age groups. More than half of Americans report losing sleep over money troubles. Money worries are the biggest cause of sleep loss, and it's getting worse. 78% of US adults are losing sleep worrying about everyday expenses, saving for retirement, and healthcare costs. Add in those unexpected expenses and wanting to save for a vacation or a new home, and the amount of stress felt can reach a dangerous level. High levels of financial stress manifest through physical symptoms like sleep loss, anxiety, headaches and migraines, compromised immune systems, digestive issues, high blood pressure, muscle tension, heart arrhythmias, depression, and a feeling of being overwhelmed. It's a vicious cycle where one causes an overflow of other issues that in turn result in even more problems. Individuals with high financial stress are twice as likely to report poor health overall and are 4 times more likely to complain of ailments. The increased medical expenses that present themselves as a result worsen money challenges, which then, of course, increase their financial stress level. Those caught in this ever-revolving loop of monetary worries and physical and mental illness issues are in dire need of a support system to help them navigate through and hopefully break the cycle or at least find a slight detour off of its path. I find this chart fascinating. It represents the prevalence of diseases by income. Before getting into detail, you can simply look at each of these major causes of illness and just see how the incidence is universally higher in the lower family income ranges. For heart disease, if you make less than $35,000 a year, 8.5% of you have this condition, whereas if you make over 100,000, less than 5% have coronary artery disease. And this goes again and again from stroke, emphysema, chronic bronchitis, and all the rest of the things cited here. The connection between financial health and personal health is more connected than you may think. We've all probably experienced some sort of stress in our lives at one point or another, but you should know the stress resulting from financial challenges is often chronic. Income is strongly associated with morbidity and mortality across the income distribution as shown. Income-related health disparities appear to be growing over time. Income influences health and longevity through various clinical, behavioral, social, and environmental mechanisms. Isolating the unique contribution of income to health can be difficult because this relationship intersects with so many other social risk factors. Poor health also contributes to reduced income, creating a negative feedback loop, sometimes referred to as the health poverty trap. Income inequality has substantially grown in recent decades, which may perpetuate or exacerbate health disparities. Policy initiatives that supplement income and improve educational opportunities, housing prospects, and social mobility, especially in childhood, can reduce poverty and lead to downstream health effects, not only for low-income people, but also for those in the middle class. Economic inequality is increasingly linked to life expectancy disparities across the income distribution, and, as with many other things, seem to be growing over time. In the 70s, a 60-year-old man in the top half of the income distribution could expect to live about 1.2 years longer than a man in the bottom half. However, by the turn of the century, a 60-year-old man in the top half of the income distribution could now expect to live 5.8 years longer. Look at this chart. It's gotten to the point now to where the richest American men live fully 15 years longer than the poorest men, while the richest American women live 10 years longer than the poorest American women. While stark disparities in mortality along this economic gradient understandably capture our attention, we should not overlook substantial income-related differences in the death rate. The United States has amongst the largest income-based health disparities in the world. In general, poor adults are 5 times as likely as those with incomes above 400% of the federal poverty level to report being in poor or fair health. There are various mechanisms through which income influences health. These can be broadly divided into clinical, behavioral, and environmental factors, some of which are closely intertwined. Compared to higher income Americans, low income people face greater barriers to accessing medical care. They're less likely to have health insurance, receive new drugs and technology, and have ready access to primary and specialty care. Low-income workers are more likely to be employed by organizations that don't offer health benefits. Less than 1/3 of low-income workers obtain health insurance through their employer, compared to nearly 60% of higher income workers. In terms of behavioral and environmental factors, low-income Americans also have higher rates of behavioral risk factors such as smoking, obesity, substance use, and low level of physical activities. These are powerfully influenced by the more challenging home and community environments in which these folks live. For example, poor neighborhoods have a higher density of tobacco retailers, and the tobacco industry has historically targeted low-income people through various marketing campaigns. There may also be limited access to cessation counseling services and pharmacotherapies, all of which make it more difficult to stop smoking. Perhaps unsurprisingly, people in families that earn less than $35,000 a year are 3 times more likely to smoke than those in families with an annual income over $100,000 a year. It goes on and on. Poorer communities have less access to fresh foods and higher concentrations of fast food restaurants. They have less access to environments that are conducive to physical activity, including open spaces, parks, sidewalks, and training facilities. More broadly, low-income Americans encounter numerous daily environmental exposures that create wear and tear on the body that accumulates with repeated or chronic stressors. You get it coming and going if you are in a low economic class here. It simply results in healthcare disparities and a lower life expectancy. Race strongly influences other socioeconomic factors, including income. Black Americans in particular continue to have both lower incomes and shorter life expectancies than do white Americans. There are many reasons for racial health disparities, but the literature suggests that a central role is played by chronic financial hardship caused by centuries of exploitation and segregation, as well as the direct toxic effects of discrimination on mental and physical health. Even today, access to education, credit, economic opportunity, and healthy environments varies across races. The relationship between race, income, and health persists within and across races. Low-income Black Americans live shorter lives than high-income Black Americans, and affluent Blacks die earlier than affluent whites. Studies show that race may be even more important than family income for future prospects, particularly for men. Black boys in wealthy households are more likely to become poor adults than affluent ones, while the opposite is true for white boys. While Black Americans have faced unique barriers to economic mobility, other racial and ethnic groups, particularly Hispanic Americans and American Indians, also have lower incomes, fewer educational opportunities, and shorter life expectancies when compared to whites. However, while people of color generally have lower incomes than whites, most Americans with low incomes are white, and low-income white Americans have been affected in the largest numbers by things like the opioid epidemic, which is thought to be partly responsible for recent decreases in overall US life expectancy. Economic justice has its own merits. The impact that income inequality has on health is yet another reason to insist on eliminating economic disparities and proving that financial status is a social determinant of health. Look for additional content on Sphinx TV to assist in your healthcare journey. I'm Dr. Jeffrey Sterling, Surgeon General for Alpha Phi Alpha Fraternity Incorporated. Thank you for watching.